So sleep. Right, have we got any young people here? Okay, so we've got sleep can be quite tricky. Adolescents, teenagers have got funny old brains. You know, they've all sorts of things. There's all sorts of pruning that's going on in their frontal lobes while they're teenagers. And they do bizarrely actually have their kind of sleep onset time a little bit later than adults and younger children. So teenagers are just, you know, it's difficult anyway because a typically developing teenager is going to be a struggle to go to bed. But if you've got somebody who's more neurodiverse and you know, social communication difficulties, and we know that the population of children, young people we're talking about, are on a waiting list for an assessment for autism, they may also have lower levels of this thing called melatonin, which is this amazing kind of hormone that we naturally produce that makes us feel sleepy. And if you don't get that sleepy feeling and you're not really socially driven to necessarily do what everyone tells you to do, going to bedtime can become really, really problematic. So what we need to do is we need to maximise trying to get habits in place. So melatonin used to just work it was kind of activated by light. It is activated by light, and so melatonin kind of surges when your eyes aren't receiving lots of light, and it depletes when there's lots of light around. And that's great when you're kind of just dealing with kind of night and day. And for our ancestors, and when they were living in caves, it was a really useful thing because they probably should be feeling sleepy when it's dark and keeping themselves somewhere nice and safe. But now we have electric lights, we kind of mucked it up a bit. So we don't really have the sorts of kind of just the pure melatonin system that we used to have. But what our brains do is they have an ability to kind of have your melatonin surge related to a particular time of day, and your brain just starts producing it then. I know my melatonin surge comes at about 10 in the evening, normally when I'm trying to watch the news. Sometimes I just think, I really want to watch this, so I will fight it. And because I'm watching a TV screen, which has got lots of light coming out of it, I can do that. And within about 10 minutes, the sleepy feeling will go. It's a risk for me to do that, though, because I won't get my next melatonin surge until about 11:30. So I know when I'm doing that I'm now going to be up for like over another hour. You know, we can fight kind of melatonin surges, and kids do this very effectively by using screens at bedtime. So their sleepy feeling might come along, but they're on their phone and they're really enjoying it, or they're watching something kind of, and they kind of fight the melatonin surge, and then they don't get their sleepy feeling, and then next thing you know, it's 2 o'clock in the morning. And they've got to get up at 7 o'clock, and that's going to be very, very tricky. So what we need to do is we need to really try and help kids build a kind of routine in order to get a nice habit-related sleep to inform your kind of circadian rhythm, which is the bit of our brain which helps us understand kind of night and day and when we're meant to be sleeping. And so if you create a routine and you create kind of sleep associated behaviors, then your brain starts producing melatonin at that time. And if you do this regularly, you'll get into a nice bedtime routine. That means that if you're trying to get a young person to go to bed at, I don't know, let's say 10 o'clock at night, then they really need to be off all devices at 9 o'clock, because otherwise their brain's not going to have that kind of association that this is bedtime and the melatonin needs to come along. And if they've got digital devices, they'll be depleting all that melatonin. So it's really, really important to ensure that you kind of create that routine. And the very difficult thing that I say to kind of families is that if you've got kind of TVs in the bedroom, that's a problem, because TVs produce this kind of level of light that's very like sunlight. If kids are watching TV before they go to sleep, well, they're going to go to sleep much later than if they are not watching TV before they go to sleep, because it's going to really interfere with their sleepy feeling that melatonin brings. So let's have so we've got, so the reason it's important is because sleep is also such an essential element of helping us cope with challenges during the day. So if you haven't got enough sleep and you've got additional difficulties as well because the social world is tricky for you, you're going to find, if you're tired, you're going to find the next day nearly impossible. So getting sleep sorted is absolutely crucial. So we've got, good sleep hygiene, bedtime routines, managing behaviour around nighttime welcome. Sometimes kids take additional melatonin, so there might be some of your children might be taking melatonin additionally. If you haven't got the sleep hygiene and sleep routine things in place, it's pointless. So even if you're taking melatonin as a supplement, if you then use a phone before you go to bed or something, it will be depleted from the brain as well. The brain just depletes it, poof, just disappears. So having that kind of digital free period for an hour before bed is crucial for that. One of the other things as well that can also be difficult is if you've got a child, think about younger children, if you've got a child who is struggling to get off to sleep at night, then the temptation is to kind of sit with them. Kind of everybody's done that. And then that can then lead to kind of difficulties later down the line because the child begins to rely on it. I think it's kind of helpful sometimes to understand how our brains work with sleep. So what actually happens throughout the night is we do go through kind of different stages of sleep, and we actually wake up about 4 times in the night. So you kind of, first of all, you kind of go off to sleep and you go down from kind of stage 1 to 2 to 3 to 4, and then you go into kind of REM sleep, which is when you're dreaming, and then you come back up to stage 4, 3, 2, 1. And then you generally you kind of wake up after stage 1. Mostly we don't notice this because we're just, we're still snoozy woozy. So you just kind of turn over and probably go back down then into 1, 2, 3, 4. The reason for it is because when we were kind of sleeping in caves and didn't have all the security we have around us now, it was quite important to wake up a few times in the night just to make sure that everything was okay, that it was all exactly the same as it was when you went to sleep. Because if something had changed, then you might need to go into an alert phase. So if when your brain brings you out of stage 1 sleep, if it notices that anything's different, it will then go into an alert phase and you will wake up properly. I mean, for me, the alert phase is normally, I need to go to the loo. So the brain will be like, oh, right, wake up. Or you might be a bit cold, and so you kind of pull the cover over you. But generally, you kind of do that, and then you go back to sleep again. That's really important. So if you've got a child who is insistent on having you with them when they go off to sleep, and then after they've gone to sleep, you creep away, what's going to happen when they come up out of their first stage of sleep? The brain's going to go, alert, 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 there's no one with me. And then they're going to wake up and they're going to get out of bed and they're going to either come and get into bed with you, or they're going to kind of insist that you come and join them again. So it's a really tricky one, but if you have a child who is insistent on you being with them when they go to sleep, you have to do this real gradual thing of kind of training their brain to cope with you being a little bit further away. I mean, I've done work with kind of families who are in that situation, and I did a piece of work with a mum who spent 3 months getting out of her child's bedroom. So she was initially co-sleeping with the child, and then she moved to sleeping on the floor in a mattress, and the mattress just inched every week, just inched out of the room. And then she actually hung out in the doorway for about 2 weeks. I think she had to sleep there before she managed to get around the corner. And then the mattress inched down the corridor until it eventually got into her bedroom. 3 months. But by this time, I think the child was 10, so this has been going on for 10 years. And it was worth it. It was 3 months investment for her to get back into her own bed, which she succeeded in doing. So you need to kind of retrain the child's brain that it is safe in kind of small steps. Most people don't have to spend 3 months doing that. For most people, you might just need to kind of maybe sit by the doorway, or when the child's going to sleep, you might be pottering around outside, maybe folding up some laundry or something, so they've still got that sense of presence. And then after you've done that for a week or two, you can start kind of getting down the stairs. But there's a reason why kids get themselves caught in these kind of habits, and sometimes it's because of the way that we've managed it. So if you do sit with your child, you are going to be likely to have a kind of tricky situation when they're waking up in the middle of the night. Okay, so how do we improve sleep hygiene? We've talked about a lot of this. Reduce bright lights at bedtime, have a wind down period and a bedtime routine. It's that wind down period and bedtime routine that's going to train your brain that this is when the melatonin needs to start surging. Low lights. The other thing as well is some kids are scared of the dark and really want a light on. So I know it sounds a bit strange, but you can get red light bulbs, and the wavelengths of a red light bulb don't deplete melatonin in the way that white light does. So if you can get yourself a kind of red light bulb, that's much better for a child if they really need to have a light on. Definitely no daytime napping. Unfortunately, if you really want to kind of get into good sleep routine, you need to keep this going through the weekends and holidays as well. So I know there'll be kind of nights when everyone does stay up late and everything, but on the whole, trying to stick to these regular patterns, because that's what trains the brain. That's how you get into a habit with it. The other thing that can be useful if you've got a child who's really struggling to get off to sleep is our circadian rhythm is the bit of the brain that kind of regulates when we go to sleep and wake up and all those things, and time during the day. You can kick-start it by having a particularly bright light in the morning, or just making sure that your child gets sunlight or gets daylight. There's not much sun around at the moment. Daylight as early as possible, because that kick-starts the kind of circadian rhythm, and it helps then kind of regulate the body's ability to know that the day has started and to start kind of ticking it through. So there are particular lights that you can buy over the internet. There's also daylight bulbs that you can buy. So the room where you have breakfast, you could get one of these particularly bright bulbs, it would kickstart everyone. It doesn't do anyone any harm having that sort of kind of bright light start to the day. Visual timetables can also really help organise the bedtime routine, and maybe kind of using things like timers and stuff like that to set limits around bedtime. So if a child particularly is insistent that they're going to have some time on a device, the beauty of devices is that they've all got timers on them. So you can say, all right, another 15 minutes, set the timer. And that takes the heat out of you having to tell the child to get off it as well. Okay, so yeah, managing anxiety at night. So we need to get the brain sleepy with our lovely bedtime routine that we've talked about. There's some nice kind of relaxation things you can do. There's some lovely CDs that you can get that just kind of create that sort of kind of calming environment. Reading's such a lovely thing to do, and I don't do it enough. I did some nice reading last week when I was on holiday, and it kind of reminded me, and now I'm reading a book at night time, and it's so good for me because it gets me into that sort of kind of sleepy feeling, and it's kind of telling your brain, oh, we're doing this wind down thing. So maybe if you've got a child who will engage in that, getting them into maybe reading at night rather than being on devices. Having this kind of routine, like you're going to go and sit and have 5 minutes with somebody before you go upstairs. It's all part of that sort of kind of routine, and it's reassuring. If you've got a child who's got repeated questions at night time that's becoming a bit of a ritual, maybe you need to have some sort of kind of worry box and write down some answers for them so it doesn't get into too much of a ritual of kind of constantly asking the same questions. And this sort of positive self-talk that we've talked about. This is okay, it's all right, it's just nighttime. Just what you're trying to do is get the child to be able to say things that you would be saying to them. Because we kind of say these lovely reassuring things, we kind of want them to be able to say it for themselves. And maybe just putting a bit of lavender on the pillow or something like that. So these are all the things that kind of train the brain. This is bedtime. The nice smell. Now I'm smelling lavender. All right, this is putting my head on the pillow. I need to do that thing, get that sleepy feeling coming. Okay, night waking. We have talked about this. I talked about it. This is related to the kind of sleep onset association. So if you've trained your child that you're going to be with them when they're asleep, then you're going to end up probably with night waking, because when they come out of their first cycle of sleep, they are going to, their brain's going to go into an alert phase. And I've talked through these strategies here.